I am Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne, on scars, and pigmentation. I do a lot with facial balancing as well. I'm going to walk you through this case as a patient I started working on just in December, and you can see just here, I think it was early December, and now here just about 4 months out. Take a look and look at his skin quality right now. So this is, he just came in a few days ago. I wanted to showcase his result because he was coming in for some Bellafill here, and now it's going to be even a better result, and at some point I'll do a little bit more laser on him. You can see, look at that. It's a really, really good improvement for the scar tissue that he really had just from acne in his case. A really nice case. I'll wait for a few more people to join us, and then we'll walk through and kind of talk a little bit about how we did this and what you could do to maximize your results when you do these scar treatments. And I got to double check. I'm actually going to take a look to see the patient's age. I believe he's in his 30s, but let me just double check for you. And I also just want to make sure that we have all the different things that we did for him. But really cool, you know, you can see for this particular patient, I know I definitely did TCA cross for him. I did subcision for him. I did laser for him. And in his case, I did the ablative form of the CO2 laser for some of the thicker parts of the scars. And then I also ended up doing a little bit of a fractionated blend of the CO2 laser and an Erbium laser. So you can see, look at that, really, really good improvement there just over a matter of just about 4 months here. So it's awesome. You know, again, you're like showcasing this over and over again. It's really fun to showcase that to people. Let me see exactly the different things that we ended up doing for him when we worked on him. Actually, the first date that we did it on was in, it looks like late November, actually. And at that time, I did do Sculptra, actually. And then we did TCA cross. I did the subcision. I did the laser, as I refer to as well. And then now when he came in, and so then he actually came in then again for a bit of TCA cross this day, and we ended up doing some Bellafill after this photo was taken. So he's going to get even a better result. And then at some point we're going to do some laser as well, which would be really good. Username 12 is saying, hey doctor, I have a question. Is there any possible way to get rid of freckles naturally from the sun? We'll start using sunblock. That's the biggest, easiest thing to do. Sunblock is really, really like the first starting point there. And then you could also try like Eucerin's Anti-Pigment Cream combined with like Tretinoin. That could work really nicely at nighttime. Start that process, and then that's probably going to be a good point really for you to start working on your skin for the dark spots. But you may need more robust treatments, and that's where like the pico laser could be a good option. I was going to actually make this a little bit bigger. Let's see if I can make this bigger here so you guys can see a little better. Are you guys able to see this photo? I don't know, because sometimes it doesn't showcase to me if you can see it exactly. I'm trying to get to the scarred areas. But yeah, you can see, look at, oh, perfect. Okay. So yeah, these are mostly rolling scars over here. And there's also this fat loss that he had. And so that's why like Sculptra was really important for us. Subcision was really, really critical for us. Really helped out quite a bit over here. User 79 is saying, hey, Dr. Qazi, I'm new here. Do you have any recommendations for hyperpigmentation from acne? Thanks for joining. Yeah, so a few things you could do for acne marks. Really, like I was talking about just earlier, it's really pretty similar. You could try Eucerin's Anti-Pigment Cream. It's a great over-the-counter cream. It works out pretty well for a lot of patients, actually, just to kind of lightly. It takes a little bit of time, but it will help actually with some light pigmentation that's on there. But if it's more stubborn, you may need a laser, like a pico laser could work well, or you may need to do something like a stronger peel, or even potentially like hydroquinone, things like that. It all depends on also the depth of the pigmentation too. Usually for acne marks like post-inflammatory hyperpigmentation, it's more just on the surface of the skin, and that can get picked up pretty quickly with a little bit of a light cream like Eucerin's Pigmentation Cream, hydroquinone. But sometimes you need lasers. So it depends on how stubborn that pigmentation is and how deep it is. What are your thoughts on 40% lactic acid for acne scarring bi-weekly? That's really aggressive anyways. You're going to irritate your skin a lot. It's not going to help too much really for the vast majority of patients either. So not going to help really for vast majority of scar patients. Are you able to tackle wrinkles at the same time as acne scars? Yeah, most people who do my scar treatments will find that their wrinkles are better too. So yeah, I definitely will get that too. Hello, what are the benefits for tretinoin for acne scars? It helps somewhat with the oil production. So what that means is basically that it will actually make sure that the oil in your skin is not causing new acne. On top of it, you can stimulate a little bit of collagen as well with tretinoin. You could notice that the scars themselves shrink a bit in size because oil production gets under control. So really, definitely really helpful, which is also why things like Isotretinoin or Accutane also help also. Why is subcision not always done when doing Bellafill treatments for acne scars? It depends on like the depth of the scars, really. It depends on really how stuck it is as well. That's really what it comes down to. Do I have to wait a month, more than a month? Let's see here. Before, I'm not sure what you're referring to. Oh, it says Euros the week is saying, good afternoon. I'm doing Nordlies laser, Fraxel laser. I did it 2 times, but I didn't find any change. Yeah, that's not going to help too much. That's really not. Also, you said good afternoon. Where are you located, by the way? I got microneedling done. Alexander is saying, I got microneedling done, and now I have damaged skin. Would you recommend chemical peels? I usually don't recommend chemical peels with damaged skin. It's like just kind of as a last resort. You usually want to try to do other treatments, mostly just with moisturizing sunblock. Start there before doing anything else that like could overly exfoliate the skin. So usually I don't do it that way. Does Accutane fully clear cystic acne? I mean, my patient the other day, he did Accutane 4 times, and I've done it 3 times. It definitely helps each time, but it's not like it doesn't really clear it up completely for a lot of people. So it's tough to say if it fully clear cystic acne, but it certainly could help a lot though. Does pigmentation come back if we stop using anti-pigment cream? That's a good question. I would say that depends on what kind of pigmentation it is. If it's really more of like melasma, then it could. If it's more just like post-inflammatory hyperpigmentation, less likely, especially if you're using sunblock, things like that. Hi, Joey. Good seeing you on. Haven't seen you on in a while. Thanks for coming on. And Period is saying, when can I start using salicylic acid after my last Accure treatment? You can do it for spot treatment. That's fine after a few weeks, but usually I put you on tretinoin. So let's talk about that because we usually want to put you on tretinoin actually. And that's usually the best way. Hi, Mrs. Jones. Good seeing you on, by the way. Thank you so much. Just wanted to say thank you for doing these vids so consistently. I've learned so much and excited to come in. Appreciate you. I say it was a really cool day. Actually, I had a lot of people. One patient flew in from Indianapolis to do a consultation. Actually, he was looking for dissolving. He was wanting to ultrasound dissolving. And this poor gentleman, he was somebody who, like he said, he was doing under eye filler. It ended up causing some swelling for him. And then the person that ended up doing that filler also actually put it in his like nasolabial fold unnecessarily, he said. And he was like told, like he went there to dissolve it and there was still a lot of swelling. And then he was like told that like it's out. And then he flew all the way in here. There was so much filler in there. So we dissolved it. It was immediately effective actually. So it helped him out a ton. And, he discovered me from this. I had another patient actually that just came in from Thailand. So he came in today. He actually is also originally from Australia, but he was like doing Muay Thai over in Thailand, which is pretty cool. I love that stuff actually too. So it's pretty cool. And then another patient today from Naperville, from Illinois. So I really, really do love the fact that people are learning about this stuff. And it's like, I want everybody just to see, like, this is the things that we could do. This is how you should do this at a very safe, high level. We could do this over and over and over again. Just be like, just be aware of the real treatments. Be aware that this takes a lot of time, a lot of effort. People go through a lot of emotions as they go through this. And it's like a proper journey that we have to support them through this whole process. So I'm happy to do it. I think that's really awesome. And I want to actually just have everybody learn about this because it's like this whole old way of doing things. Like this patient also, he did so many treatments beforehand. So many people over and over again, they were told that they either can only do like microneedling or do something like low energy lasers, or they're just told they can't do anything for scars. That other patient the other day went to her dermatologist and they said there's just nothing you could do for scars. And it's just like really unfortunate, it's really, really an unfortunate type of statement to make, because of course there's things that we could do for scars. It's just, there's may not be within that person's arsenal, but it's appropriate really to refer out. It's appropriate to really suggest find somebody else that could do this type of procedure. I don't have to do this, but there's someone else out there. And so I think that's where this world should go towards. And hopefully it's getting there now. Purity saying, I've scheduled my third month post-acute treatment. Will I be prescribed tretinoin? Yeah, usually I do it at the third month there. I usually just let the skin barrier just heal. I want to make sure actually none of our patients really get excessively dry. So that ends up helping out a lot then. So I do it that way. Khalud saying, are you no longer streaming Instagram and Facebook? The last few times I only saw on TikTok. I'm not sure if somebody was reporting my account or something like that over there. Somehow I'm safe over here right now. But I'm not sure what's going on. Something was going on there. I don't know what was happening. And so I'm here for apparently I'm like a 30-day thing that they can't I'm not able to stream on multiple devices for a little bit of time. So that's why I'm here. So hopefully tell everybody that I'm over here instead of at some point I'll go on everything else again. But at least you guys are on here. How many times in a lifetime is it safe to get an aggressive erbium laser done? And it depends. I mean, I'm not sure if you really need aggressive erbium laser. I'm not so sure if you really need aggressive erbium laser. So if you really need, I do it every 6 months or so, 6 to 8 months or so, I do a low energy, I do low heat, low energy erbium laser. That works out really well. So that works out perfectly. I would recommend doing that way. Let's see here. How do you deal with patients who aren't satisfied with their results? Diane is asking, how do you deal with patients who aren't satisfied with their results? So that's a good question, actually. So a few things. One is that a lot of times I found that patients really that weren't actually too satisfied were people who sort of didn't do everything I recommended in terms of volume replacement. A lot of times, even in the initial consultation, I'll say there's a lot of volume loss over here, and they'll assure me that they're going to do volume at some point, and they don't do it. And it's I'm doing subcision so I could do volume, actually. So what that means is basically I'm undermining the scar tissue, helping actually the areas where it's tethered and stuck. So that way when we do volume in the future, it's in the right, correct spot. So it's if they're not doing that, it's tough to actually be able to say that we're going to be able to get the best possible results. For people who actually do follow what I say and do work with us and do things honestly and appropriately, we do have a lifetime warranty. We do. And what that means is that future sessions for your laser TCA cross is 55% off. So that's awesome. And it's there we go. It's I do that way. There's been a few people very, very few people, but there's a few people where I did do things. I found that I thought I did it really the proper way. They tried their best. They said that they've worked on making sure that they're, avoiding the sun, doing everything else properly. They were managing their acne and their oil, things like that. And very, very few of those. But if I look at it and we look at it together and we're looking at this, it's there's just not enough of an improvement over here. After several months, 6 months, a year, it's not where I expect it to be. It's not that it's a full result at that point, but it's not. And I'll tell you, and I'll just say this openly, that I have done it for them again. I just did it. I would just take care of it because sometimes I just need volume, or sometimes I just need to see that maybe this particular skin type, I'm not too sure if it's going to be able to handle the laser as much as I wanted to that first session, or for whatever reason, their collagen response was just really poor. I really do find that there's a lot of reasons why that may be. Some people, it turns out, vape more than they say they do, and they said that they won't, and then it turns out that they do, and there's a lot of that actually. There's a lot of different things like that that can factor into it. But if you're just a straightforward, honest type of person, you're looking at things, it's just objectively, we're looking at this together, and it's this is not, where you expect it to be, I'll take care of it. Who else says that out there in the world? And every patient of mine knows that. Everybody knows that. So if you do hear things about that, it's kind of interesting, because it's chances are that they either were doing things that they weren't supposed to be doing and they don't get the lifetime program for it then. And I told them to do certain volume replacement, things like that. They didn't do that. And, or I just found them dishonest. I found that they just weren't really, doing the things I told them to do properly. And they were doing other creams, other things. And it's very obvious that it damaged their skin and did other things. And I just didn't trust them. I didn't trust that I could do a laser again on them. Didn't trust that even the first time that I could do anything properly with the laser energy device, because it's just, I saw that they were tan. I saw that they weren't aren't using the pigmentation cream properly, all those things. Like this is like, there's a lot, this was going to work two ways for everything. And it's like, I have like I'm going to make sure I can put people through and make sure that we can get the best possible results. But at the same time, it's like, if I can't trust people, sometimes it's like, I'm not going to be able to do that, because I'm not going to be able to push the laser the way I want to push it, because it's like, how do I know you're not going to go on and get messed up with the sun exposure eventually? I'm not sure. It's like, I can't cause, and the last thing I want is that somebody gets that kind of, I did push it a bit for them, use a stronger laser for them, and then they end up getting sun exposure, and then they blame me for the laser that caused that. Like, it's not my fault. Like, there's nobody else that's having this problem. It's just you that had like the sun exposure that way. So it's there's a bit of give and take with all this, and it's like tough to find that balancing act. Doctor, please consider an LA clinic once a week. We can't. I have so many patients over here that come to us, and I got to make sure it's done at a very, very high level. So we just make sure that the team is doing what it needs to be done to keep this really safe and do it at a really, really high level. My doc is pressuring me on Microneedling even though I've tried about 10 treatments. Oh, I think you definitely should get a different opinion for that. I think you definitely should. I have dark patch on one of my cheeks where my sideburns is. What is that? This is after I shave. That's usually post-inflammatory hyperpigmentation. Usually it's due to like a little bit of redness and irritation. And then that's like just a little bit of sun exposure from that then. Let's see here. Heart, please stop spamming the text. Appreciate it. What did this patient have done? This patient did a few things. We did subcision, we did laser, and we did some Sculptra for the patient. And so the way we did the laser was we did ablative form of CO2 laser, fraction form of CO2 laser. We did Sculptra as well that day, subcision that day. And then when he came in this photo, I did a little bit more TCA cross and some laser that day. Let's see where we're at. What can we do to or avoid for optimal collagen response? Good question. I mean, there's a few things. Like I was mentioning earlier, is that one of the biggest things is smoking. Smoking and vaping, huge factors for poor collagen response. And you'll be shocked how many people vape and smoke right now today. A lot of people vape and smoke. And they are aware of this issue. They know about the consequences of it, but they still insist on doing it because it's just like the vaping, everybody just got them hooked on it at a young age. And it's like tough to get them off of this. And so that's a big factor. Another huge factor is really UV damage, like just little bits of sun exposure, even inside. I'm shocked at how many people have not been told that indoors you have to wear sunblock. You're still getting sunlight indoors. And so especially for patients that do these scar treatments, I got to walk you through this because it's like, we got to make sure you're doing that. And then on top of it, like just diet, like you're making sure that you're not having dairy products. You're not doing things that are inflammatory and like just junk food and processed food. Just cut all that stuff out. Really make sure that you're eating a lot cleaner going forward. You're just a healthier lifestyle. It's going to be really helpful for you. You can't control the genetics part. You just can't do that. But the other parts you can. And Jay saying, will smoking like twice a month affect my collagen? Yeah, every single time you do it, it destroys it. Every single time you do it. And it's when it comes to scars and healing, it's a vascular issue. It's a vascular thing that we want to be able to exploit. We want to be able to really help the microvascular circulation in the areas that we just worked on. And if you smoke, it just prevents that. That's the thing. Delize is saying, I cut out dairy. That's been hard. Yeah, that's been hard for me too. When I did it years and years ago. I used to drink like 4 glasses of milk every single day. And it was really tough. It was really tough actually, because it was like every day I was doing it. And then I was realizing that maybe this is making me like not feel the best. It was just like, I wasn't sure. I was like bloating and things like that and making my skin got better after I stopped it. And nobody was telling me that was the case. I wish that was like they told me that. Does subcision with fillers help with rolling scars? Yeah, that's, I don't necessarily think that you just do fillers though. I would really recommend more along the lines of doing things like, for example, you want to do something like collagen stimulating like I did for this patient, which is Sculptra. You could do Bellafill, you could do Radius. All those are potential options, but I wouldn't necessarily do, I wouldn't really just recommend doing just like a hyaluronic acid filler. I don't think it's going to help enough. Let's see here. Where was it at though? How can I get rid of PIE? PIE really tough because sometimes it's a little stuck on the surface of the skin, those little blood vessels. You may need to do a laser. The easiest thing to start with is azelaic acid, 10%. See if that helps you out. Try azelaic acid, 10% there. Could be a good idea. If it doesn't work out, then really just go ahead and zap it. And I don't know if this person, the Bellafill thing is like, the heart just keeps on asking about that. Are you doing something like an Amazon affiliate thing? It turned out all these guys that were doing this stuff, everyone was asking about beef tallow. And it turned out like this was a whole like thing with like this Amazon affiliate stuff too. And so I don't know if that's a new thing that you guys are doing now too, this Bellafill thing, or whatever you pronounce it. But like, whatever, whoever wants to pronounce it properly. Janice is saying, getting under the skin bumps in the same area of my cheek where I have big pores using salicylic acid to no avail. You probably want to do something to control more with the oil production itself. You could start with different over-the-counter cream, but you may need something a little bit more robust for oil production just internally. So maybe that's what it is. Naira is saying, I did the phenol peel. It was intense, but did nothing for my scars. Naira, sorry to hear about that, but I want to kind of figure out if you could talk a little bit about what kind of scars you had. Was it ice pick scars, was it boxcar scars? Was it rolling scars? Did they do anything else like subcision? Did they do anything else like fat transfer or volume replacement like with Sculptra, Bellafill, anything like that? And kind of walk us through a little bit about that because Naira's saying that rolling scars and it was just the phenol alone. So that's probably the biggest problem is that for rolling scars, you definitely want to do subcision first. Usually for phenol patients, we do subcision about a month beforehand, and then we do the phenol afterwards. So it may be the reason why. I'm not sure if that's exactly the reason. Another problem is that with rolling scars, usually there's a lot of fat loss, a lot of fat destruction. So you likely need to do something for that volume, something for the fat. And if that wasn't done, you really do have this issue where you may not feel as happy then because of this. So I would recommend really strongly considering something with like volume replacement. If you have rolling scars, double check to see, is that what you really like that? Is that what you need to do to solve this? Like what I mean by volume is fat transfer or potentially like radius or Sculptra like we did for this patient. So all those are possible solutions for it. But just double check to see like what happened with your volume because it's likely due to that. And you probably needed subcision, unfortunately. Smiley is saying, is there anything other than limiting sun and sunscreen to prevent hyperpigmentation after a session? And I will find that there's a lot of things. Usually I prep the skin a certain way. I use a pigmentation cream to do that. And then we use that afterwards so that we get that so that you don't have that problem. Triple X is saying, does poor diet contribute to collagen destruction? Yes, it does. Absolutely it does. Poor diet does contribute to poor collagen response. So poor diet could contribute to a poor collagen response. So things like really fatty food, the processed food that we eat all the time, all these things are just causing inflammation, causing a lot more oil production there. And that's the problem, really, is that you have an inflammation like that, you don't develop as much collagen afterwards. And we run into a lot of problems with patients because they get like potentially like oil production afterwards. And it's like, struggling for months and months like that. Thank you, Life of Magical. Appreciate you. What is the best form of collagen supplement replacement? I mean, I haven't heard of anybody saying there's a great option really for that yet. I'm open to it. If you guys have a brand, you could take a look at it. I haven't discovered it from any patients that I've had though. Jaden saying, what are your thoughts on hybrid fractional laser such as Halo for pitted acne scars and PIH? Really, unfortunately, not going to help much. There's a lot of patients who have done it and they say it did not help much at all for their scars. Gap Tooth Dummy is saying, my post-electrolysis scars are small oblong bumps the same color as my skin. Do you treat those? And it's possible, yeah. I mean, I treat all forms of scars, so it's possible that those can improve with lasers, but we have to take a look and see. Usually with electrolysis scars, I need to do a little bit of TC, a little bit of acid to help with it. So I'm not sure exactly what kind of scarring you exactly have, so we could take a look and see what's happening there. Are taking collagen pills helpful? I mean, start really like the basics. That's what I was referring to earlier. So start with this. Start with the basics, which is like stopping sun exposure, making sure that you're otherwise healthy, you're eating well. And people are asking about vitamins. Actually, vitamin C and omega-3 is really important for the healing process. Collagen supplements, questionable, really, really questionable if it really does. I think if anybody feels like there is, let me know. I heard so many patients that say that it didn't help them. Some people said it did, but some people said it didn't help them. Mrs. Jones is saying, Dr. Qazi, I've had acne scar pitted for almost 40 years. Is there a hope for me? Pitted scars, yeah, we just have to go slow with it. It's just going to take a long time. The middle part of the cheek takes the longest, really. The sides, actually, the lateral part of the cheeks, a lot, like you can see that like 6 months or a year later, but the middle part of the cheek could take like almost 1.5 years to 2 years sometimes. Does having chemo affect pores? Affects so many different things, usually with more like destroying some fat. And then also a lot of times what can end up happening is that you actually get more oil production as well. So they may end up seeing it because of that. Otherwise, I'm not entirely sure why, it'll be like, related, but because of potentially just there's a little bit more oil production in the skin, there's some fat loss there, you may end up having, especially initially, where you feel like the pore size is a little bit larger. And then you can consider something like tretinoin, usually is safe, so consider something like that, but depending on where you're doing, or I should say you're doing chemo along with anything else, that I'm not sure. Life of Magical is saying, I'm currently taking Accutane. I've heard that hormonal acne comes back after a while. Is that true? For some patients, yeah, it's true. I mean, sometimes it's like the oil gland doesn't respond just the way it did before before Accutane. But there's some people that really is really very, very oily still, even after Accutane. It can be really depressing because they were on Accutane and then their hormones can fluctuate for multiple different reasons. And then, you get the acne again. And now it's difficult because it's like tough to go on Accutane again, because it's like, 2 forms of birth control and then family planning stuff, things like that. It's really difficult, really, for a lot of patients. And also there's like a cost involved with it. So for people that don't have much money, it's like this really does affect them a lot worse. There's a lot of patients that, like, if you look at it, the reason why they had the scars is because they didn't have access to, dermatologists or physicians to manage their acne properly. And like they didn't go to like those type of people. And it's like, unfortunate, my patient the other day, he had such severe scars, really severe scars. And he's a Hispanic gentleman, and he was telling me how he just was too poor. He's just like, I knew I had really, really bad acne, the worst cystic acne in like the school. And, more like he said, his whole family had some acne and things like that. But his family just couldn't afford a dermatologist, couldn't afford even a physician. They couldn't even afford it. And even if you can afford it, like something like Accutane is so expensive. At least in my time, it was really expensive. It was maybe 120 or so, and that was like in 1980 money. So who knows how much that is worth now? It's probably like I don't know how much, 120 to 180 dollars. And we had good insurance actually. It was still expensive. So it's like there's always like a reason why they don't accept it. What is the timeline of results for Subcision? So you do see like that swelling effect initially, which you probably like, but what ends up happening is that there is a collagen response to occur, and that's going to take several months later on for that collagen to develop, almost like a year, like really for collagen. So I would say that really there's some improvement like initially with that, because we did break it up, it lifts up, and there's some collagen response, which is going to be like somewhat. But the thing is that there's some fat loss there usually. And that fat loss is something that you're really going to have to take a look and see. Maybe you might need to do something like volume replacement, like, for example, a fat transfer, or Bellafill, or Sculptra, any of those options there. Is Bioma safe for my 11-year-old to use? She's into Sephora Ulta phase. You're talking for acne-prone skin. Why don't you just keep it really simple, really straightforward? Just do like 10% azelaic acid is good. And you could just get that over the counter, and then just do that with a gentle cleanser, and start there. Really, just like do that. Do azelaic acid 10%, gentle cleanser, and then also do like have her take zinc. Zinc is safe. Do 25 milligrams of zinc. That's probably a good idea for her as well. So just things to consider like internally too. If she could take omega-3s, it would be really nice too. Great for brain development also at that age. So helps the skin, helps that. So like keep it really basic and simple. Vast majority of people do not need like these skincare lines. Like they don't. Here and there, of course, I try a lot of different things, like so many different things. Some of them I do like. I don't like say that there's like wrong things to do, but it's should be pretty easy for the vast majority of people. If you want to kind of like do like little small bits here and there, you want to try, Sure, do that. But like, I don't agree with a lot of these things that people say that they have to do like this multi-step skincare routine. And it's like, otherwise, like your skin's going to be terrible or something like that. It's just like, no, like there's got to be something else that we could work on and like underlying this issue. There may be something that's causing the oil production. There may be something that's causing your skin to look a little bit more dull. And let's figure that out. So, you know, like look at it holistically instead of just trying to get this expensive skincare line that's just masking this problem here. Lisa saying CO2 or microneedling for textured skin. Well, you know, textured skin, that's like you could do a mild for textured skin, mild texture. Microneedling is probably okay, but CO2 is awesome. Nothing beats like a laser. I usually use more like a low heat, low energy laser, like Erbium laser for just mild texture, though, to be honest. It's amazing for that. Really great. Briefer is saying, how effective is microneedling for acne scars? Not going to help out much for scars, unfortunately. Vast majority of patients, it does not help out with, especially for deeper, thicker scars. What's the difference between Sculptra and Radius? What is better for deeper scars? For deeper scars, in terms of volume, Sculptra probably gives you the most volume. And then Radius, it helps somewhat with volume, but it also helps a lot with collagen production. The skin quality is better with it. And you do get a little bit of elastin production as well. The skin just feels a little bit more firm as well. So, which is pretty cool. You know, it's a pretty cool fact that you can have both of those things with like an injectable. I also use Bellafill a lot. We can use any of those. I've heard lasers and high heat treatments can cause fat loss or volume loss in some patients. Is that true? And it's a good question. I mean, I think that it's done like in certain areas around the eyes. They use really high heat, high energy. I think theoretically it's possible that could happen, but you'll probably run into other consequences of someone doing that. Like it's like your eyes become really scarred. It could be really a really prolonged healing process. I doubt that it would really be for the vast majority of times, you know, for patients, even in places that don't know laser settings, things like that. But when it comes to, you know, rest of the skin, we're not burning and melting. We're not going down that deep with high heat and high energy. And one cent is saying, do you still have skin pigmentation cream on your website? You know, it was so popular. So many people were getting it. But the thing is that we need to make sure that we had it for our regular patients all the time too. And now with all like everything that's going on in the world, I just need to make sure that like we have everything that we need. So we were really well stocked with a lot of stuff, but we got to make sure that like it just goes properly for our patients. And then like for people that are doing these online orders, they would be like secondary. So I think we took it off for now, and at some point we may put it on again. But like we just got to take care of make sure that all of our patients have like everything they need, so it's safe for them when we do these treatments, things like that. And it's been really helpful. So if you're not a patient, then that's unfortunately the answer really right now. The patients really, we just have to just give preference to for the pigmentation cream. All right, guys, thank you so much. Appreciate everybody. I will see you again tomorrow. And hopefully we'll showcase some more things. Any more questions you guys had, I'll try to hit those again tomorrow. Thanks so much, guys.